My name is Dr. Mike Yeadon. I've spent my entire professional life leading research and early development of new medicines for respiratory and skin diseases. Spent over 30 years in both big pharma and in biotech. I have a training in biochemistry and toxicology and a PhD in respiratory pharmacology. In big pharma, I was once the most senior person in Pfizer's discovery research group. I was responsible for everything to do with respiratory drugs in research and early development. After that, I founded my own biotechnology company, which I led as CEO, and ultimately was able to sell that to Novartis, a big drug company. Around that time, I also was highly sought after as a consultant to other biotech companies, and I consulted to them, advised about 30 companies over a 9-year period. So those are my credentials. I would say the professional opinion that I provide to you is that of someone who's deeply experienced in the scientific procedures and practices of creation and testing of molecules, in particular for their safety, their lack of toxicity. So my underlying training in toxicology, mechanistic toxicology, allowed me many times to detect and steer away from structural features or contents of potential medicines that could cause harm, based on my wide knowledge of those things that sadly have harmed humans and animals in the past. And so it doesn't really matter if an individual like me worked in vaccines or heart disease or respiratory, because the principle, the core of my testimony is about the safety and toxicity risks of any new medicine. And it's about that I am particularly concerned, and I have been since the middle of 2020. So I'm just going to outline maybe half a dozen points that I want you to take on board. I could give you many more, but just for brevity, and others of my expert colleagues I think will expand these points. The first one to know, which is shocking if you don't know this, is there was no pandemic. There was no new illness called COVID-19. What there was all of the normal human illnesses that people get. Acute respiratory illnesses like influenza are real, but we had that misattributed through incorrect diagnostic tests and told you had COVID and it was spreading. This was not true. There was a long-planned deception, and it used well-known human weaknesses, our susceptibility to fear, our credibility when authority figures tell us things, and that was misused. So no pandemic, no new illness. And because I worked that out, and I'm totally sure about this, I know that the people behind the so-called vaccines also knew this. Senior people, my peers in the pharmaceutical industry, my peers in the pharmaceutical industry also knew this. So did the regulatory agencies like FDA. So did senior figures who guide administrations in governments, and any supranational organizations like the WHO, I'm afraid, also knew this. There are two major things I want to talk about. One was the treatment of people who had this purported new illness. What they had was the normal range of illnesses that humans have always suffered from, amplified by fear. And what happened was that medical treatments in care homes of seniors, in assisted living facilities, were changed radically in 2020. And I knew this because of my underlying training, especially in respiratory diseases. I knew, for example, that treating people with opiates like morphine and sedatives like midazolam was the wrong thing to do. If you treat elderly people on their own with midazolam and morphine, which was the standard treatment for COVID, what it does is they are respiratory depressants. They slow the rate and depth of your breathing, and eventually, if left alone with these treatments at night while asleep, These people literally faded away and died. They were killed by their treatments. They never needed them. They were known to be inappropriate and contraindicated if they're used together. The person has to be under active medical monitoring. That did not happen. I'm afraid my conclusion is they were murdered. I don't think the doctors who gave them these drugs early on knew that would be the consequence, but later on, I'm afraid they did, and they are culpable. In hospitals, large numbers of people were put on mechanical ventilators, the kind of breathing equipment you see in the movies. I can tell you this much. I'm not a medical doctor, but I've been around pulmonologists and respiratory specialists for 40 years. You do not take a person who is walking into the hospital, able to breathe unassisted, even if distressed, who did not have a blocked airway or gunshot, knife wound or crush injury to the chest. You do not sedate, intubate and ventilate these people. Why? Because God and nature left you a perfectly adequate apparatus to breathe in and breathe out. If you needed extra oxygen, it would be easy to provide it with a mask or nasal cannulae. In fact, that is the normal non-invasive treatment for people in respiratory distress who have unobstructed airways and no injury to the chest. You do not sedate, intubate, ventilate. If you do, this is an aggressive procedure, life-saving under certain circumstances like head injury, drug overdose or elective surgery. But under other circumstances, what happens if you do that is it gradually produces lung injury and the person fades away, and you have to increase the pressure day after day in the pump until they die of what's called adult respiratory distress syndrome. So that's the second way in which people were wrongly treated, because top-down medical protocols for COVID-19 that didn't exist were known by people like me to be harmful and ultimately lethal. And finally, in hospitals, people were given ineffective drugs that were known to be dangerous. And the classic one is remdesivir. Nurses on clinic started to call this drug "run, death is near" after a while. And that's because remdesivir, if given persistently, kills people. So I hope I've outlined to you there was no acute public health crisis, and the treatments given to people with these alleged illnesses, which were other illnesses, were wrong. They were bad treatments in care homes and hospitals. But the really important thing I need to tell you about, because this comes from the core of my training, and then decades of application of looking for potential toxic vulnerabilities in a medicine. It was in the core of my training to look out for molecules and components that were picked up for good reasons to accomplish some medicinal aim, but might have toxic liabilities. When I describe to you three things about these so-called vaccines that I know as a professional from this industry that gave birth to them must axiomatically cause injury or be known to be risks. I could pick others, but there are three that I know to be true from the heart of my being in training. The first one is, we were told that these molecules were gene sequences that encoded something called spike protein. The spike protein, we were told, was on the outside of this virus. Now, I don't agree with that, but this is what we were told. A cartoon like a sphere with spikes coming out of it. We were told these vaccines encoded the protein, the spike protein that sat on the outside of these viruses, and this would train your immune system to fight it off. Ladies and gentlemen, is a really important concept in immunology. It's taught to every person who has a training in immunology, as I did, in the first lesson. What allows your body to treat itself kindly, but to go to war if something untoward is discovered in your body? And the concept is this: self, non-self, or foreign. My body is healthy right now. My immune system that is surveilling all parts of my body is at peace with itself, because everything it encounters is known to it to belong to Mike Yeadon itself. If you inject me with a gene sequence that will make my body manufacture a foreign protein that isn't me, that is a viral protein, my body, every cell in my body that follows that instruction, will signal to my immune system that I have been attacked, and my immune system goes to war and attacks and kills every cell that complied with that instruction. And that is what has happened, ladies and gentlemen, to every cell in every tissue in every person who has been thus injected. The toxicity that you would experience varies tremendously, because some people would take it up efficiently, copy it efficiently, make the protein for a long time, and I'm afraid those people are mostly dead. Other people took it up poorly, transcribed it poorly and only briefly, and those people are alive. And then there's every continuity in between. But that point, that if you inject an instruction that makes your body make a foreign protein that is not self, your immune system will attack it. Ladies and gentlemen, you know this. This is the principle of tissue matching in organ transplantation. This is the principle behind failed tissue transplants, organ rejection. This, ladies and gentlemen, is the basis behind autoimmune diseases like rheumatoid arthritis and many others, and neurological diseases where your body destroys itself. That is the first principle that was designed into every company's molecule: Moderna, Pfizer, Johnson & Johnson, AstraZeneca. So I knew by the middle of 2020 these were designed to cause injury. How much I didn't know, I still don't completely know. But this expert is telling you that they were designed to cause injury. The second really important point to tell you about is what was encoded in these gene-based vaccines, alleged vaccines, is spike protein. I didn't know what spike protein was. It was new to me, but it's the spikes on the outside of this alleged virus that I don't think is real. I could find proteins like it, and I found all of them were known to be toxins, like neurotoxins, cardiotoxins, and things that would prompt blood coagulation. So again, the question, why would you encode in your helpful medicinal product something that when expressed in your body would harm you? That's the second thing. There is a third one, which is when I discovered it late in 2020 or early 2021, I have to say I cried. Two of the products made by Pfizer and Moderna were formulated. Every medicine is formulated. You'll be familiar with a tablet. It might be film coated or dry. It might be a capsule of various sizes. It could be a liquid for injection, an inhaler. All of these, you have the active principle, but it's surrounded and protected with something that helps it do its work, hopefully beneficial work. Two of these products were wrapped in something called lipid nanoparticles, or LNPs. Lipid is fat, nano means tiny, particle means little blobs. So they were wrapped in lipid nanoparticles, and I looked them up and I thought, oh, that's quite interesting. They had been used before in certain oncology drugs. But here was the thing, as a toxicologist, when I started researching, I thought, these things are known to be toxic. And the further I explored, here is the shocking thing. Lipid nanoparticles, every one of them tested, is known to promote the uptake of their payload, whatever they were protecting, into the organs inside your abdomen, what's called the visceral organs, and most prominently liver and your ovaries. So, ladies and gentlemen, the person who picked lipid nanoparticles to formulate these materials knew professionally that when it was injected into women and girls, this material would travel around their body and concentrate in their reproductive organs. And then it would do those two things I just described. It would be expressed and your body would recognize it as foreign and kill those cells. It would, when expressed, cause toxicity directly to those cells. And I ask you, ladies and gentlemen, what possible motivation could you have for doing that when you could have picked half a dozen other means of protecting the drug? And I have to say, at that point, I knew deeply in my heart that the first two observations I made weren't just like mistakes or things they would ride the risks. These three things together told me someone got in a room, someone like me, and said, Dr. Yeadon, design injections that will injure, kill, and reduce fertility in the people you give it to, and design it so that it won't kill everybody, it won't injure everybody, but if we give it to enough people over time, it will lower the fertility in their health and reduce population. And this is what I have watched happen all around me for 5 years since that moment. I've been speaking out and warning of this for 5 years. What I've just told you, I did not make it up after the fact. I wrote these things down in December 2019, and along with a German doctor, Wolfgang Wodarg, we put them in writing and sent them to the European Medicines Agency, the second most consequential regulatory agency in the world. We sent it to Emma Cook, who was in charge of the EMA. She did not even reply. The day after we published this open letter, I was removed from all social media. The day after, I was attacked by the main UK broadcasting agency, the BBC, who started calling me a conspiracy theorist and a purveyor of misinformation. So my ability to reach out to people was cut down by 99% from that day. Meanwhile, I was paraded on Radio 4. There was a Woman's Hour program that named me as a misinformation spreader. And guess what the official from the government, guess where they came from? They came from the Royal College of Obstetrics and Gynecology, and they defended these injections and said, ladies and gentlemen, don't listen to this guy, this conspiracy theorist. Listen to me. These are safe and effective and essential to protect your health and that of your unborn child. And I can't remember the name of this lady because they have scrubbed the interview. But I have to say, at that point, I decided I wasn't going to get mad. I was going to get even, and I have been speaking out without fear ever since. And if you believe anything I have told you, I say to you, you have a duty to repeat whatever chimed with you the most, so the next person you can tell. The worst that will happen is if I'm wrong, the worst that's going to happen is you're going to get laughed at, which is no big deal, is it? But if I'm right and you don't say anything, you're going to lose your freedom, and then you're going to lose your life. That's really all I have to say to you, Judge, and this is my testimony.